So as I enter the room, I'm going to check for all the equipment. There's suction catheter. This is a size 12G catheter, which is appropriate for this adult male patient. Sterile glove. This is the appropriate size for me. Sterile water. The Gallipot. This is for the cleaning of the suction tubing, and the water-based lubricant. There's the manual resuscitator bag by the bedside for emergency, just in case. And then I'm going to test the suction regulator, turning it on, occluding the tube to test that it's working, and then dialing the pressure regulator to 100 to 150 millimeters mercury pressure. It's working well. I'm going to turn it off. So I'll proceed to follow standard precaution, do my hand rub, alcohol rub, step 1, step 2, step 3, step 4, step 5, step 6, step 7. After I'm done with my hand rub, I'm going to don my PPE, starting with the surgical mask, apron or gown, in this case an apron, followed by my gloves. And I'll proceed to see my patient. I'm going to introduce myself. Mr. Sim, good morning. My name is Clement. I'm a physiotherapist. I'm here to help you with your lung condition. I hear that you have a lot of secretions in your lungs which may be causing you to breathe, having difficulty breathing. Okay, so I'm going to do a quick assessment and may need to do some treatment on you and later on help you to get the phlegm out from your lungs. Okay? So before I proceed, I'm going to check your heart rate and your oxygen saturation. So I'm going to turn it on and establish the baseline for your heart rate and oxygen level. Mr. Sim, can you try to cough for me? Okay, it sounds very wet and it sounds very weak. Can you try to cough it out? Okay, it's difficult, right? Okay, I can feel there's tactile parameters on the patient, over the patient's anterior chest wall, over the patient's central airways. So there are indications for airway suctioning. So Mr. Sim, I'm going to try to get the phlegm out from your lungs. Okay, and I have to do this by putting a tube down through your nose into your airway, in order to suction the phlegm out. Okay, it's going to be a little bit painful, so I'm going to get you prepared. Is that okay? So I'm going to take away your pillow first so that your head is more neutral. On the count of 3, 1, 2, 3. Okay. So before the suctioning, I will hyperoxygenate the patient. The patient is now receiving 35% oxygen therapy through a Venturi mask. So I'm going to turn it up to 50%. Okay, and change the flow meter from 9 liters per minute to 15 liters per minute. Mr. Sim, give me a couple of seconds to get prepared, okay? I'm going to prepare for the suctioning procedure. So I'm going to turn on the machine, and it's already been calibrated and dialed to 100 to 150 millimeters mercury. I'm going to open the suction catheter, only revealing the regulator tip, connecting that, okay? I'll then open the sterile gloves, okay? So this entire surface is still clean and sterile. I'm going to prep the lubricant. Because this tube is already been used, I'm going to discard the first drop and use the second drop instead. Okay. For the sterile gloves, you need to be careful to maintain sterility. So I will only hold on to the corners of the paper. Okay. Anchor the mask and slide my hand into the sterile gloves. Okay, and pull to secure. Okay, then I will use my non-dominant hand to pull the catheter out of its sheath, and then using the clean hand, to touch the catheter. So my dominant hand with the sterile glove and the catheter are clean and sterile. So I'm going to hold the catheter like a pen or pencil and lubricate 1 or 2 centimeters of the tip of the catheter. And Mr. Sim, I'm going to pull the oxygen mask down to your mouth and you can continue to breathe through your mouth, and because I'm going to put this tube down into your lungs through your nose. Okay, I need you to tilt your head up a little bit. Very good. And here it comes. It's going to be uncomfortable. Okay, as I insert the catheter, I will watch for swallowing action through the movement of the laryngeal prominence. If the patient swallows, the catheter might go into the esophagus, so I don't want that to happen. So when the patient swallows, I'm going to stop what I'm doing, pull back a little bit, and then get the patient to take a deep breath in and advance the catheter. So take a deep breath in, Mr. Sim. Very good. And if I've entered the trachea, the patient should be coughing because the cough reflex will be triggered, and I will continue to advance the catheter until I hit a soft spot or resistance like so, and pull back a little bit, apply continuous suction on withdrawal. Finishing the procedure in no more than 15 seconds. Okay, I'm going to put back the oxygen mask for you, Mr. Sim, and allow you to get more oxygen. All throughout this procedure, I'll be monitoring the patient for any adverse reaction. Okay. You okay, Mr. Sim? Can you try to cough for me again? Okay, it sounds much dry. And there's no more tactile parameters. I don't need to suction anymore. I think I'm going to discard this catheter. Okay. And then turning this inside out so that the catheter is inside the sterile glove. I'm going to tie a knot so that it doesn't come out because this is biohazard waste. Okay. Come, let me give you back your pillow. Ready? 1, 2, 3. Okay. Patient's vital signs are all good. I'm going to put you back on your original oxygen therapy, which is 35%, and I'm going to dial the flow meter back to 9 liters per minute. Okay. Mr. Sim, I'm going to take a listen to your breathing to see whether you need further respiratory physiotherapy, okay? I will need to unbutton your shirt in order to listen to your lungs more appropriately. Okay. Deep breath. Very good. Deep breath. Deep breath. On the side. On the side. I'm going to slide my stethoscope all the way to the back, okay? Sorry. Okay, and one more on this side. Okay, sounds great. The lung sounds quite clear actually. So I think I'm going to just let you rest for now and come back in a couple of hours or a few hours time to check whether you still require respiratory physiotherapy. Okay. So the patient is already 30 degrees head up. I'm going to remove the little probe from your finger, and I'll come back to check on you later. Thank you very much, Mr. Sim. So after the suction procedure, I'm going to clean up the area. I'm going to pour some sterile water into the gully pot, which I will use the water to flush the suction tubing. So I'm going to dip the tubing into the water, and it will flush the catheter clean. Turn it off. I'm going to make use of this catheter sheath to store the tubing. Okay, so the catheter in the sterile glove will go into the biohazard bin, and the rest of the waste will go into the general waste bin, and I will proceed to degown.